India is the second most populous country of the world. It has changing socio-political, demographic, and morbidity patterns that have been drawing global attention in recent years. Despite several growth-oriented policies adopted by the government, the widening economic, regional, and gender disparities are posing challenges for the health sector. A majority of rural deaths are caused by communicable, parasitic, and respiratory diseases which are somewhere linked with an unsanitary environment. About 2.3 million cases and over 1,000 malaria deaths occur every year in India. An estimated 45 million of the population are carriers of microfilaria, 19 million of which are active cases, and 500 million people are at a risk of developing filaria. One of the significant agents for downfall of rural health care is inadequate human resources in the health system. About 75% of health infrastructure, medical manpower, and other health resources are concentrated in urban areas where 27% of the population lives. But more than 70% of Indian population lives in rural India. Due to the low level of health facilities, the mortality rates due to diseases are still high. Healthcare is the basic right of every individual, but the lack of quality infrastructure, qualified medical functionaries, and non-access to basic medicines and medical facilities has thwarted its reach to 60% population in India. The non-accessibility of public healthcare and also the low quality of healthcare services makes people turn to the local private health sector. Speaking in terms of statistics, 92% of healthcare visits are to private providers, of which 70% is urban population. But private healthcare is very expensive, unregulated, and variable in quality. It is unaffordable by low-income rural folks. To control the spreading diseases and the growing mortality rates, special attention needs to be given to healthcare in rural areas. Low quality of care, poor accountability, lack of awareness, and limited access to facilities are some of the major challenges that we face in these areas. India, like many other developing nations, will have to create a robust infrastructure for managing healthcare workers and facilities. With a corrupt, paralyzed system and decades of inefficiency behind it, the journey towards a working system will be a long one. First steps have still not been taken. Richa Sarod Dalal, Democracy News Live, New Delhi.
Good evening. Welcome to Democracy News Live. To our show, It Matters. We cover issues which really matter to you as a population, whichever be the population, whichever be the country. India has a genuine issue with rural health and how it manages it. While no disrespect to the people who will be joining us today on the show, because they all put in effort and work in rural India, but the reality on the ground, when you get down to the basics, is there are huge challenges. Some health centers do not have the equipment. Other centers do not have the doctors or staff. And then many don't land up in their offices. So there are certainly challenges around it. There is no doubt about it. I've been to many myself. I've seen what the state is. Forget rural, sometimes even urban centers are ill-fitted and the staffing is not adequate. So we're going to have a little discussion around it. Also, on the end of the discussion, we'll go a bit into talking about how and when will rural India get its COVID vaccine. But let me start the show by bringing in our guest today. We have 3 doctors from medical health centers. These are public health centers run by the government. And then we have a researcher who did a study across rural India to give us a sense of what it is. So joining us today is Dr. Sanjay Kumar Singh. He's the medical officer in charge of the public health center in Alika. Also joining us, Dr. Jyoti Singhal. She's the medical officer in charge of the public health center in Amarpur. And Basant Dubey. He's a district immunization and child officer in No. Also joining us is Dr. Neelmani Jaysawal. He's the assistant professor, Department of Social Work, Vishwa Bharati, Sriniketan, West Bengal. Let me start by asking you, Dr. Sanjay Kumar, when you look at the health services and the centers, what do you think their state is? What is your perspective? Do you think they're at par with global rural public health services?
Good evening, everyone. First of all, I would like to tell that rural health services are not at par, but it could, with minor changes and training, it could be, and with the improvement of the resources available, and we can improve the resources also. And with that improvement in the resources, we can be at par with the world health, rural health standard. Uh, but what I feel about this situation, like government is going to roll out the vaccine, corona vaccines, COVID vaccines in nearly 1 month's time. Uh, we have already running a immunization program in our country, which is one of the biggest in the world. It is not like we are doing it for the first time. 2.6 crores of newborns are taking birth every year in India, and they are getting immunized. With 2.8 crores of pregnant women are getting immunized. So the system is already in place. Only is like a training part is should be improved with the workers for this COVID vaccines, like how to give the vaccines with simultaneously prophylaxis of not getting contact with the COVID patients. We can we can excellently improve our immunization of COVID. And one more thing is like we have already experienced one successful campaign in India. If we can remember, 2.5 years back, India has done a campaign of measles and rubella, and it was for 9 months of child up to age group of 15. And India has successfully, in a phasic manner, they immunized almost 80 to 90% of the children of that age group. So I can believe strongly believe that we will be able to achieve successfully the COVID vaccination if we go by phasic manner. If I go by phasic manner with a high risk population first, like if we immunize the health workers first, because they are
Sure.
having more with contact of the COVID patients, and then the frontline workers like police personnel and NCD workers. And then if we target the population of more than 50 years, because they are always with 70% of the population with more than 50 years, they are always with their comorbidities and they are at a risk. So if we go in phasic manner, we'll be able to achieve our target of immunizing the
Sure.
population of whole India. And
Sure.
already the equipments and resources are available. It is not like
Sure.
we have to improve so much, because we are already doing the immunization program. So
Sure.
our
No,
ILRs are there.
Dr. Singh, I want to first hit at what's wrong with rural. And you are probably sitting at a good center in Alika. It seems like a good, solid center. You have lots of resources. But when you get down to the village level, and we see accidents, farm accidents, sanitary issues, there is a lot of challenges around. I have carried patients from middle of UP 300 kilometers for getting surgeries done in Delhi when there was an emergency because there was nothing open there. If you went to that hospital, you were sure to lose that arm, or there was going to be an issue. And we see thousands of patients lying outside in the footpaths in front of AIMS, the All Indian Institute of Medical Sciences. So there is certainly something missing. We cannot deny that there is massive amount which is missing. From your perspective, what is missing? And I think if we can concentrate on that, we'll possibly be able to find better solutions for rural India.
First of all, sir, we are talking about the immunization thing of COVID, and
No,
now we are getting distracted with the health
so
problems the rural population are feeling, they are facing. So, what I
we're not
want to just
distracted, sir. We are I agree with you we're not distracted. The show is around rural health primarily. We are talking on the end of it. We will talk a bit about the immunization, and it's a great idea that immunization is in place, and we know India's immunization programs have been in place, whether it was polio. But rural health in itself is a big issue. So I don't think we're getting distracted. What I'm trying to understand from you, what is that is missing in rural health, and if you can highlight that, that will help us understand and get the resources for rural health that are required.
correct, sir. Correct. Two things mainly is like one is the population. Population is a major factor in India. Like we need to add more hospitals and health staffs, first of all, according to the proportion to the populations, which is missing in India. The second thing is the awareness of the people that they how to get the facilities how to achieve the facilities and how to get the facilities and how to approach the hospitals at what conditions. Like government is there with some free policies of treatment. Like in Haryana, there is Mukhyamantri Muft Ilaj Yojana. Sometimes they don't know how to get those facilities, and they are not coming to the facilities. In spite, they are going to some public
So
places,
private
practitioners, private hospitals and private practitioners. Even if they are not getting the adequate amount of facilities, some quacks are sitting in the rural places. They are getting lured by the uh, they are feeling more comfortable because there are less queue, less populations, so are there that less time consuming, so they are easily approachable. Because of that only they are approaching the private practitioners.
I think you made a very good point. The facilities aren't enough, vis-a-vis the population. The facilities that exist may be able to serve an X amount of population, but if it's going to have 30 times more people than it can actually serve, then it's not going to serve the purpose. I was in a hospital when last year in Rajasthan when I was doing a film around the pandemic, and I realized I was in a small hospital, very, very dedicated doctors, but the doctor was sitting in a ward with H1N1, and there were 50 people who were surrounding him literally. They were all standing waiting around him because obviously they can't afford it, so they couldn't go anywhere else. They've come a long way from their homes to come to the doctor, 20 kilometers walked, some of them on buses. But so they were right there and they were crowding the doctor all around, and they didn't know what to do. The doctor has to still serve them. He has no choice. But it's a very, very big challenge. Let me bring in Dr. Basant Kumar Dubey. Dr. Dubey, you know, I know
नमस्कार
it's
सर.
not a
सर नमस्कार.
namaskar. Namaskar.
तो सर
I
I
know.
want to brief as you are asking ना the things about rural India, and we have worked quite a lot in Mewat here. तो sir, may I sir?
Please, that's the question I
हाँ.
want to ask.
हाँ, तो just let me brief you, sir. So we have a plan here in Haryana, especially Mewat, as Mewat is an aspirational district. So what we have done in this last 1 year, I will tell you, balki I will say in last 6 months. So we just analyzed the population ratio for the facilities, and as per the IPHS standards, Indian Public Health Standards, and Indian Health Facility Guidelines are given. They are online. So we have planned it for increasing our facilities from present level to the next needed. So what we planned, there are 7 levels from 0 to 6 for health facilities, and we can provide level 2 facility by e-Sanjeevani OPD. As e-Sanjeevani OPD has now been started, online OPDs are running there. So we have planned an OPD with general OPD and specialist OPD in Haryana here, and all persons from their room, from their home, they can avail this level 2 facility of specialist consultation here. And we have proposed the sub centers, health wellness centers, and PHC, CHC subdivisional hospital and the district hospital as per norms, and they will soon be finalized. I think maybe the plan is in 2 phases, 1 and 2 year phase,
Dr. Dubey,
and by two
Dr.
years,
Dubey,
ji,
Dr.
ji, ji,
Dubey, I
ji,
have a question for you,
हाँ,
sir. Now,
जी,
you are aware what the standards are.
yes sir,
IPHS obviously has a standard, and you
yes
know
sir,
what the levels are, right?
yes sir,
Will you
ji,
make me understand what is the difference? How far apart are we from what it is and what it should be? What does the
sure
government
sir,
have to do to make sure that doctors such as yourselves are able to deliver justice at some level
sure.
to the profession?
I will just. Sir, the first thing is, let us move from the level zero. Level zero is we provide facilities from ANMs, from with the help of ANMs to all the village persons. है ना? We have tours of ANMs in different villages under the sub center. So what we lack in the sub center, we should have residential facility, and as per the delivery load, if there is delivery load, we should have residences and labor room also. There should be delivery facility there. So we lack that. As Mewat is there, we don't have water. Water is not a good resource here. So we have to fetch it from far off places, from the mountains and from other places. So we have a plan of desalinizing the water here, making it soft. Softness will be put at different centers so that soft water may be provided to the district. So Vardhe DC sir is Dhirendra Khadgata, Shri Dhirendra Khadgata is there. He is planning that also with Irrigation and Agriculture Department. So that will remove the water scarcity and it will be available in the sub centers. Anganwadi centers, health wellness center, all are there, but water is scarce.
What
So
you're
that
saying, Dr.
availability
Dubey, that
is important.
what you're saying, Dr. Dubey, there is at this stage there isn't even water to carry
This
out.
is the first, yes, this is the first thing. But we have planned it and we are providing it, Hana, and it will be improved obviously, I think within a year. So this is the first thing. Water should be there, and it is water scarcity is there in Mewat, in Nu. The second thing is that good internet facility is not there. So government of India had planned that five in free internet facility will be provided in each village, and one will be a Wi-Fi Chopal. Wi-Fi Chopal will be there in Panchayat. So we have done that in Mewat also. That is being done by CSC and BBNL, Bharat Broadband Network Limited and Customer Service Center. They have been given the tender, and we already have a line here in our district hospital and civil surgeon office of 100 Mbps. It can be increased to 1000 Mbps as per our chosen plan. So we have now 100 Mbps speed here. That internet facility was very much important for uploading, downloading the data in HMIS also, and in the COVID app for the COVID vaccine trial and rollout. It is also needed. So it was very much difficult for updating the data, the templates on the portal. But it became easy for us as we have a high-speed internet in this rural setting of Mewat. It is an aspirational district also, sole aspirational district of Haryana. So it has increased. It was the lowest, and it has increased
So
to I
you're
think
saying
52nd
there's no
position now.
water right now. Internet has just arrived.
Uh,
Are there enough doctors? Are there enough beds?
yes,
Are there
yes,
enough
yes, sir.
nurses?
The COVID is has been a boon to us, this COVID, and we have quite a lot of doctors now, but still we lack field level workers because the plan always is as per the sanction of the health facilities. So we are a good growing population of around 40 birth rate here. So we are regularly updating the facilities also. But the problem is that to update the facilities with such a fast pace, it is difficult. So what we have a plan here and we are following that. So we will have a sanction of the facilities required, and क्या कहते हैं, we will deploy HR, human resource, and it will be running in the government buildings, panchayat raj buildings, and maybe rented buildings if needed. So level zero,
Let
one,
me, let
two,
me,
they may be
let me also
taken
bring
care
in
of.
Let me bring in Dr. Jyoti as well. She's standing by. Dr. Jyoti Singhal, you're in Amarpur, and I know, as we've heard from Dr. Dubey and we've understood from Dr. Kumar as well, that there is a genuine challenge on the ground of lack of rural workers, of facilities, medical facilities, even water in the places like Mewat. Explain to me from your end, when you actually look around in your rural district, how large is the challenge and do you think it's fixable?
Good evening, everyone. Uh, since I'm working here for more than 10 years now in Amarpur, so I have never faced a challenge like this. I don't know, it's NCR or, yeah, the availability of water, electricity, and internet has never been an issue for us in Amarpur. We have well connected uh, by roads, and there's good transportation services as well. So I really don't think I have never ever faced. So I just cannot personally tell you about the challenges in Mewat or in Nuhu. And I
So if
think
I came to your center, Dr. Singhal, do you think, somebody like me gets unwell? Do you think people like me walk into your center to get primary or tertiary care if it's required?
I think you'll be surprised to know that people not they'll not enter, but definitely they'll take my opinion for that. If they're visiting any tertiary hospital, so they'll definitely visit when they come home and they visit me. We really want your opinion. Should we go for it? Is there any surgery or any like medications, there's too many, can we remove them? I think it's the over treatment, these kind of things. People are coming, and I won't say only the poor people are coming to primary health centers. Now there are no more primary health centers, they are actually health and wellness centers. The services that we used to give initially, the primary care, the primary health centers were for the primary care of the population of the area, but now it's basically comprehensive primary health care. That the sectoral approach that was initially followed is now more segmented. It's need based care, more comprehensive. The services they have expanded, like in form of not only the MCH services. When you look for like maternal and child health services, are not only the primary thing that we're looking here.
Sure. So
It's
what you're saying,
we are like
Dr. Singh, what you're saying is that the center you are at is very well staffed, it's very well equipped, and there is nothing more required. You're at the level that a great health center globally should be. Let me bring in Dr. Neelmani Jaysawal. Dr. Neelmani Jaysawal is a researcher. He went around, he researched the facilities, and he came with some conclusive results. He's got um, enough data to tell us a bit about the state of healthcare, rural healthcare specifically, and overall healthcare in India, which is public. Please give us a little sense of what were your findings, Dr. Jaysawal.
Yeah, Mr. Gandhi, I was listening to our respected doctors who are the real fighters in this pandemic period. The research which I did sometimes back in 2015, it was basically based on the situation of not only the infrastructure in the health scenario, but also the workforce which is involved in terms of mitigating any kind of health problems in the rural areas, and at the same time the coordination between the practitioners in the ground and as well as the research institutions. So based on my study in the villages, because my university is in the villages, and we have the students who go to the field and they try to undertake various cases related to various diseases like tuberculosis. Even sometimes they take the cases of neonatal care, the cases of pregnant women. So I found that it's not the only problem of healthcare staff, which are supposed to be very much less in terms of numbers, right at the very base level, like PSC, sub centers, and also community health centers. But at the same time, the kind of coordination between the research centers and the healthcare staff is also one of the reasons. Like we have different kind of research centers in Pune. We have different kinds of researches going on even in Delhi, like different kinds of immunology researches are going on. But how the healthcare staff will be equipped to deal with that at the ground level, that's really a gap. Because we find that at the ground level, we have the healthcare staff. After NRHM, when it came out, we had ASHA worker also to take care of the immunization. But the kind of scientific know-how, the kind of equipment which should be there at the PSC level and sub-center level to take care of any emergency situation. Like I had also visited some of the villages where due to lack of the physical infrastructure, the road connectivity, even the deliveries used to happen only in the households rather than going to the PSCs. Even in the PSCs also, the labor rooms are not well equipped. Like we do not have a facility of proper medical equipment or the availability of ANM every time. So sometimes we find that not only the healthcare staff but also the kind of coordination between the tertiary level of institutions and base level institution is also one of the reasons behind the very paralyzed kind of rural healthcare system. I also tried to get some of the data. Even today also I am doing studies on the basis of that. So I am finding that even today we have PSCs after NRHM came into existence, and we have the CSCs, but still 40.5% of PSCs in the country are functional, and rest of the 60 and 59% of PSCs are not functional in the sense that it could have all the requisite facilities. Even only 72% of PSCs have been called to have adequate labor rooms where the delivery of pregnant women can be held successfully. Even if you see the kind of vacancy, as Dr. Dubey also pointed out, that there are lots of issues regarding even the availability of doctors, availability of nursing staff. So we find that in 2020, according to the government of India statistics, there's a vacancy of still 7,715 doctors in the PSC and nearly 290 physicians at the CSC level. And if you see the nursing staff, it is also like 6,126 nursing staffs who are not available, or the vacancy is there. So if this kind of vacancy are there in those healthcare institutions, definitely the approaches of the healthcare, the access of the people to the healthcare institution, maybe in the number it may increase, because we may see that the institutional deliveries are now reaching to nearly even 70%. So it's a good sign for our healthcare system. But the kind of specialization in those healthcare centers where the doctors can hold a specialization, and doctors can hold the deliveries in a very successful way, it's still a question mark for us. Again, we see the number of the doctors who are quack also, which is very much prevalent in the rural area. We may have a lot of doctors passing out from medical colleges, but in the rural areas, there is still the prevalence of quacks. So if we see that percentage also, which I tried to see, that nearly 35 to 40% doctors are still quacks in the rural areas, who may have the degrees, who may have the requisite specializations, but at the time of any kind of surgery, they are very much failure. And lots of neonatal and maternal deaths are also very much aligned with that kind of
Sure.
problem in the
Let me
rural system.
let others weigh in on what your findings are, and I'm sure they'll be able to. Mr. Singh, do you want to weigh in on what his findings are? Are you aligned with what the findings are, or do you feel differently?
Sir, previously also I told you, like, the main thing is, with the ratio of the population India is having, we need to improve the resources, like human resources, as well as the infrastructure in all over India. We are sitting in an NCR population, and because of that, our facility is up to the standard. But if we compare the whole India, the farthest corners of the facilities which are serving the poor people, for that, I think the standard need to be improved, and that can be only improved by improving the human resources as well as the infrastructures availability. Uh, I think if we do these things, and with that, with awareness of the public, the more awareness the public will have, more successfully will be able to cater the poor populations of the country.
Okay, Dr. Dubey, do you want to weigh in as well? Because I think you were very aligned. You obviously were talking about how
I
things
will share
have to
things, sir.
change.
Ji. So
Say it
we
in a way
have,
that people understand, so that sometimes
yes,
people don't understand abbreviations, but people will understand if you explain.
I will, sir. I will. Sir, there are certifications of the health facilities here all over India, and in Mewat, as I said earlier, कि it was the lowest in aspirational district rankings all over India. Some districts have been nominated by the Prime Minister that they are aspirational districts. We have to aspire high for improving our facilities in all the sectors. And in health, it was lowest, but it has increased. And we are having PHCs which are Lux certified. We have delivery huts which are certified, Lux certified, and people are availing those facilities. But saying about the private facilities, we don't have private here facilities here much, but people come in our facilities and they have improved. And what is the reason? I will tell you, sir, as yes, the specialist doctors are a problem. We don't get so much specialist doctors in our government facilities, and especially in Mewat, we are giving them high salaries also, but still people don't come here due to various reasons. The people think that the community is different, है ना? Most of the doctors are Hindus, I will say, but the community is different, so they feel a bit shaky. Maybe that is the reason. Maybe it is in periphery, it is not in the NCR, it is a bit far from the NCR. But still, we have now government doctors are quite enough, and facilities are Lux certified also. Many facilities are there Lux certified, but we are improving upon them. the facilities. And as sir said here, na, what let me brief you, sir, about we have NBSUs, and first NBSU trainings was conducted here by the government of India, and Mewat was a part. Mewat and Sirsa was there, Nu and Sirsa was there. So we conducted the newborn stabilization unit trainings, and newborn care corners are also, and we are training them regularly with integrated management of neonatal and childhood illnesses and facility based integrated management of neonatal and childhood illnesses. And for that we are training these ANMs in IMNCI training, integrated management of neonatal and childhood illnesses, with
Right.
injectables also. So they are providing that in village level. At village level,
So,
injection
well,
ampicillin,
Dr.
gentamicin
Dubey,
are being provided.
Dr. Dubey, let me lay it out a bit. So what you're saying is that there aren't enough specialist doctors. That's one of the challenges. Again, you're in the process of getting
They
a lot
don't
of these
come. This is a
certifications.
challenge. This is a real challenge.
It is an
Ji.
issue, and it's an issue not just in India. It is an issue globally that rural facilities do not get the quality of doctors. Governments have to make sure that people land up in rural facilities for a few years. But what's missing at many levels is when people need the specialist treatment, the government hospital should be able to take those patients in an emergency to those hospitals. Forget taking them, even sometimes when you get on a highway to take somebody in an emergency, people will not give way to an ambulance. And I know, I'm sure you guys as doctors have seen this enough, that it is certainly a big challenge area. Dr. Singhal, I know your center is possibly the most phenomenal center in this country, and you have everything that you were talking about. But do you feel that other centers, possibly not yours, obviously, requires a few changes, or do you think India's rural healthcare and even public healthcare is at its perfect situation?
Yeah, definitely. It'll take time. When I see, like, if I see about Amarpur, like 10 years ago, I was just looking, I was going through these data of all this maternal death and infant death rate and sex ratio, of course, and the equipments, the training, the staff, the healthcare workers. Uh, Actually, the things are improving. It'll take time, but things are improving. When we see this Ayushman Bharat Yojana and the Health and Wellness Center, the scheme that has come up, it has like given a lot of funding has been done, and we definitely don't face any short of funds when it comes to providing services, healthcare services in the community. Besides, there has been this kayakalp, kayakalp, the quality of cleanliness and the hygiene in the hospitals. We are trying to achieve that. We are trying, and we are succeeding also. We have received like Kayakalp award for the last, these initiatives by the government to improve the standards of the hospitals. It has, it is having impact on the health services, and definitely the parameters they're improving immensely. There are 100% institutional deliveries now. Maybe the awareness level, that the generation of awareness level in the community, that has improved with various village health level programs that are done, whether it's RBSK, that is Rashtriya Bal Swasthya Karyakram. We have many success stories. I've seen them, I've witnessed them, I've interviewed those patients. The congenital anomalies or any nutritional deficiencies or any kind of neural tube defects, these kind of the congenital anomalies that the children are facing, the heart diseases, they are, early intervention and early treatment has definitely led to the improvement in infant mortality. And these programs, and not only RBSK, there's RKSK, and there's this nutritional deficiencies, is a major source. As you said, the 80% of the
Sure.
Indian rural kids they are deficient. So MSP program, micronutrient supplementation program,
Sure.
or these are definitely helping out.
Sure, absolutely. So, what I think the point everybody is making is the facilities and the health isn't at the level it needs to be at. There are gaps, and those need to be fixed. I'm going to go around. I'm going to come back to Dr. Neelmani Jaysawal. When we come down to now being ready for COVID vaccine, Dr. Jaysawal, do you think India's rural areas are ready for it first? Second, do you think they'll get delivered to the rural areas so quickly? Because according to our information, it's still many, many years away by the time most of the population will get it. But obviously, there are people in rural India that need to get it as well, the older, the frontline workers. Um, Explain to me, from your study and your research, do you think the Indian health system, the rural health system, is capable of delivering the vaccine in its efficacious, solid manner?
Yeah, Mr. Gandhi, I just like to highlight here that although we are talking about the very deplorable condition of our rural healthcare system in India, not only from the perspective of infrastructure but also the trained medical staff, but this is also a plus point for us that we have a huge number of human resource which can be trained as far as the COVID vaccination is concerned. Because as we know that today all over the globe, lots of companies are experimenting with COVID-19 vaccine, where Pfizer and Moderna are very much high in terms of their production. But when it comes to India, like our own AstraZeneca COVID vaccine, if it comes into our periphery, and where we may have the high level of efficacy due to the storage requirement and all those things, our medical staffs, the frontline workers could also be trained enough in a proper manner to reach out to the households even in the rural areas. But the problem is the infrastructure, whether we could have the proper cold chain maintenance in the villages. Could we maintain a kind of connectivity from the healthcare centers to the household? Because India is not a plain country. India is a country of hills. India is a country of terrains. We have lots of problems of connectivity through the roads, because the communication channels are not very much smooth. Somewhere it's very much rough. So whether we could maintain the similar kind of cold chain, the storage facilities in all those distant places, this is really a challenge. Otherwise, in terms of human resource, we have a huge population to take care of themselves. Because if we recruit the paramedical staffs, if we include more and more volunteers who could be required for vaccination of COVID-19 in the remotest corner of the country, they could definitely be a very fruitful resource person and human resource for us. But the problem is only in terms of infrastructure. If
Cold
it
chain,
can be maintained,
infrastructure of the
definitely
cold chain.
we can be able to have the 80 to 90% success in terms of universal coverage of COVID-19 vaccine.
Sure. Let me bring in Dr. Sanjay. Dr. Sanjay, do you think to reach to the most further rural area, India has a cold chain that can deliver?
I do believe, strongly believe, because what we are saying that we are already catering to the immunization need of the populations. Like in every district, there are 2 days which are fixed for immunizations, and ANMs are taking those vaccines to the remotest of the village once in a month, and all the beneficiaries are benefited by vaccination. And I think just a addition means we are doing the same thing. We need to just fine tune the process to just add on the COVID vaccines, and I believe that we'll be able to cater the COVID vaccination need of the population, and we'll achieve successfully the 100% immunization which government targets for our citizens of India.
Dr. Dubey, I want you to weigh in. Do you think in your district there is enough cold chain available to access the last individual to deliver the COVID vaccine?
Yes, sir. At present, we have quite supporting SCPIU, sir, there, Dr. Virendra Halawat, and the team of UNDP, led by Dr. Ajay Verma here in our state. And we have got all the cold chain equipments required by 10th of December. So we have enough ILR and deep freezers now. Talking about our district, we have quite for the enough for the healthcare workers now, है ना? And in the next phases also, I think most of them will be available because we are running regular intensified immunization activities here in District Mewat on daily basis. So it is mostly a challenge here as we have vaccine preventable diseases like diphtheria, measles, and other things. So we have enough supply here, and the data collection is also completed for the first phase. Maybe second phase data will also start running now on. So it is good.
That's
The
good
cold
news.
chain here
That's
is
good
good.
news, Dr. Ram. That you are able to provide the cold
I
chain
will
and you
add
guys.
on.
Yes,
I
sure.
will add on, sir. We have solar panels here also at all the primary health centers and district hospital and DVS also. We have 7.5 kilowatt solar panels already implanted here in our district and 37.5 kilowatt in the district main district hospital. So we have electricity facilities also here. It is 24 into 7 almost. So that is good. So there is no problem now on. For the
That's
time being,
good
it is
news.
good. We are well.
That's good news. That's good news. Dr. Singhal, even at your center, obviously, you think you're completely equipped to handle the COVID cold chain that's required for the efficacy of the vaccine.
Yeah, definitely we have a cold chain point, and it's not something new. We are working in this scenario. Vaccination mass campaigns have already been done so many times, and it's something not new for us. We are quite equipped. We have this COVID application. This is the first time that the digitally, the vaccination, the mass vaccination will be done, and that will be uh, on the spot online. The name of the beneficiary would be there. We'll already be having the list, and after verification from the application, the ANM will be immunizing the person, the beneficiary, and the beneficiary will get an SMS for the next dose also,
Well,
date and time
it
of the
sounds
next
like
dose.
it sounds like a hunky-dory situation, but we know it's
No,
not
no,
an
no, no,
easy
no, no,
challenge.
not it's no, no, no. It's we have done many campaigns. Like if shortly we see, we have done Mission Indradhanush, or whether it's measles and rubella campaign. They have been very successful, not only in the state but in the country, I guess.
India is a campaign epicenter. Certainly, there have been great successes, but the challenges of health continue to be very large. India continues to have issues around its rural health. The population continues to suffer. As we heard from the research, over 60% of centers do not even have a decent functioning labor room. Those are challenges, and countries like India or the other parts of the developing world continue working on it. They want to continue delivering to the population. It's a far cry, but it's a fight that'll have to be fought. Thank you for joining me for understanding India's rural health, and thank you for giving your insights into it. Good night and good luck.